So cognitive behavioral therapy helps patients identify the triggers that can lead to alcohol use or any type of substance use disorder, and not just identify what those triggers are, but develop healthier ways of reacting to those triggers so that they're not turning to alcohol as a coping strategy. So put simply, we can look at stressors, or we can look at situations in life as occurring in a linear process. There's some sort of situation or event. We have some interpretation of that event that directly leads to our emotional, physical, and behavioral consequences. Using alcohol as a coping strategy or drinking copious amounts of alcohol is a behavioral outcome. We can tie it back to the situation, but the situation isn't what causes it. Rather, it's the thought processes in reaction to that situation. So we can modify the drinking behavior. One way is by addressing the situation and trying to avoid those situations. But there are a lot of stressful situations in life that we just can't avoid. And so it comes to changing the thought processes about those, modifying how we interpret those things. And in most of the cases, what we find is that the thought processes that we have that lead to maladaptive outcomes tend to be unhelpful and inaccurate. So helping patients become aware of those thought processes and changing them is a part of what we do in cognitive behavioral therapy. And while that sounds simple, it's actually very difficult because our thoughts are deeply entrenched with us. The thought processes don't just evolve in a stressful situation, but our thought processes evolve early on, starting from childhood. And so breaking some of these patterns, changing how we perceive ourselves and our role in the world can be a very challenging process.